You know, it's interesting. Most patients come in and want IVF, ART, and they think everything else that you want to do are hurdles until they get to the holy grail of ART. The truth is that a very small proportion of patients need it. Some patients respond to insemination. Some patients respond just to ovulate drugs that increase the number of eggs that they make in an individual cycle. So definitely ART has increased the number of patients that we can help. We've learned a lot about other therapies as well from ART. So the expectation that you should go right into ART, for patients to go right into ART, IVF or ICSI or whatever, is premature on their part because the other therapies work.
Infertility testing has actually become much simpler than it was 10 years ago. There are 3 specific important tests that must be done on anybody who's trying to have a baby. And the 3 tests include a HysteroSalpinogram, which is an outpatient X-ray to see that the inside of the uterus and that is normal and that the fallopian tubes are open. That's test number 1. The other test is a semen analysis, because we all know that sperm-related factors can cause infertility in a large percentage of couples. The third test is an assessment of what we call Ovarian Reserve. We do a blood test called FSH, Follicle Stimulating Hormone, early in the menstrual cycle, because as it turns out, FSH levels are indicators of egg numbers or quality. So an abnormal FSH could indicate that there's less eggs remaining in the ovaries, and therefore fertility could be reduced. Those are the 3 major tests that should be done in anybody trying to conceive. In addition to those 3 major tests, there are other tests that can be done. For example, a laparoscopy, which is a surgical procedure to look through the belly button into the pelvic area to see if there's any endometriosis or scar tissue around the tubes. We would normally reserve that in situations where the woman is symptomatic of endometriosis or the doctor is concerned that endometriosis may be present. Other tests that we do include something called the Clomiphene challenge test, which is a test that provokes the ovary to respond to Clomid. And we can measure FSH levels before and after Clomiphene to see how many eggs are remaining in the ovary. Ovulation testing is important in some situations. However, if a woman is having regular menstrual cycles, that woman is ovulating. So I would encourage everybody to save their money. Don't run out and buy ovulation predictor kits. Don't bother measuring your basal body temperature record, because if you're having 28-day cycles, you are ovulating. If somebody's having irregular cycles, that person may or may not be ovulating all the time. So in that situation, certainly other testing could be done. But I think a lot of women spend a lot of money in trying to time ovulation and determine if ovulation is occurring with tests such as ovulation predictor kits or basal body temperature records. And many of the times it's just not necessary. Everybody wants to try to do something to help themselves. It's a natural instinct when it comes to infertility testing and treatment. And this is certainly one way of meeting that need. But most of the time, a history is the most important testing for ovulation. And certainly in certain situations, for example, to time insemination treatments, ovulation predictor kits can be very good.